Before we proceed, keep in mind the researchers in this particular research, which was basically a systematic review of other RCT randomized control trials, was primarily looking for the outcome to see if probiotic use reduced antibiotic prescriptions. Not necessarily reduction in disease time or illness or reduction in illness altogether, which there's a strong correlation to as well as we look at this research. Just primarily to see if probiotics may reduce antibiotic use. So dosaging and length of time will vary depending on the study that was utilized by the researchers that they reviewed. In some cases, the studies lasted 4 days. In other cases, the studies lasted as long as 9 months. And I'll have that link for you as well. And this is in the supplemental material, so you can research that and look at it at your own. But my primary purpose here is review the research without interjecting any publisher bias. So let us begin. Probiotic use may reduce antibiotic prescription. There are studies supported in part by the International Scientific Association of Probiotics and Prebiotics, that could be a potential COI, so keep that in mind, and published in the European Journal of Public Health, found that when the results from 12 studies were pooled together, infants and children were 29% less likely to have been prescribed antibiotics if they received probiotics as a daily health supplement. Now this is the kicker. When the analysis was repeated with only the highest quality studies, this percentage was increased to 53%. Pretty amazing. So, how did they conduct this? I want to keep on saying systematic review, and this is important too. So let's review, and I'll read through it really fast and slow down on the highlights of this particular paragraph. The majority, 11 of the studies, assessed the impact of probiotics on respiratory and gastrointestinal tract infections. 4 studies focused on respiratory tract infections. In the remaining 2 studies, 1 assessed common conditions including respiratory and gastrointestinal tract infections, and the other assessed fever, diarrhea, and other illnesses. 13 different probiotic interventions were assessed, although all involved individual or combination of Lactobacillus and Bifidobacterium strains. Now keep in mind, details and preparations are in the supplemental table 51. There's a link to that, which anybody could open, and I'll have that link for you as well. The methods of delivery also varied, including dry powder, mixed with formula, express breast milk, milk or milk products, water or juice in a cereal, or given within a commercially prepared yogurt drink, or as oil drops, tablets in a slow-release pacifier. So basically what the gist is, any way they can get it into the system, there is benefit that was derived. Although, it says that their intervention durations ranged from a median of 4 days to 9 months. Across the included trials, although the duration of probiotic in the majority of studies was greater than 1 month. All the trials sought to reduce the risk for infection rather than treat an acute or chronic illness. An overview of the study characteristics, as I stated before, is presented in supplementary table 51, which as you go to the DOI, you easily can find. But to proceed, and this really should be the conclusion or the general outcome. But now this information here that we're reading is actually from the full study itself. So to delve a little deeper into that full study, to proceed, why? Potentially, 3 potential hypotheses as to why. Probiotic consumption may be associated with reduced antibiotic prescribing for several reasons. First, probiotics have been shown to reduce the risk for common illnesses. If fewer common infections occur, there are fewer physician visits and therefore fewer opportunities for antibiotics to be prescribed. Second, probiotic consumption has been shown to reduce the duration of symptoms. If an infection resolves more quickly, there is a good probability that a person will seek less medical care, reducing the opportunity for an antibiotic to be prescribed. Third, probiotic consumption may simply be a replacement for antibiotics as patients and clinicians manage self-limited illness. Indeed, much antibiotic prescribing for common acute infection is likely unnecessary and may be a response to social and emotional factors. So basically what they are saying is where a doctor would feel obligated to give an antibiotic in certain cases, knowing that that antibiotic has a low risk of any benefit, especially in regard to particular viral infections, they may do that just the same so they can feel like they're doing something. In this case, instead of prescribing an antibiotic, in order to feel like something is being done, they prescribed the probiotic. So pretty interesting results altogether. Again, when filtered for the high quality trials, they show up to a 53% reduction, which is incredibly amazing. Also too, keep in mind, you can go to the supplementary table, and they give a nice detailed explanation in regard to how each one of these studies that they chose was actually conducted, durations, dosages, and so on and so forth. So that's available to you as well. Again, pretty nice study altogether. Correlation, and eventually, hopefully with future studies, will validate. Also too, before I just talk too much, the study was conducted in infants and children. In order to be direct, for adults, those studies or systematic review, meta-analysis, or whatever, will also be needed to conduct it again to confirm the same results as they have for children or those a little older. Again, Ralph Giordano signing off. All the information will be linked for you. Thank you very much for listening, and I look forward to see you all once again in 7 days. Catch you then. Bye.